Welcome everybody to the Spring Roundtable for the CACCN BC Chapter, and thank you for the presenters for agreeing to take some time out of their day to share their learning and knowledge with us. My name is Sybil Hoyce, and I'm joining you today from the traditional and unceded territory of the Silks Nation here in sunny Penticton. So we have a group here from BC Children's Hospital, Jason Marchand and Parker Mills are going to talk to us about supporting pediatric safety and care across BC. So I'll hand it over to you both for that. Thank you for joining us.
Perfect. Hi, everyone. Thank you for having us. Jason and I are coming from the same office. Can you hear me okay? Yeah, okay, perfect. Yeah, we're coming to you from a shared office here, so I'll just share my screen. Perfect. Okay. Hi, everyone. Sorry about that. Yes, I'm Parker and this is Jason. We're very happy to be here. We were asked by you guys to kind of just present on the critical care outreach role and kind of the service and support that we can provide kind of from a pediatric critical care lens to the rest of the province, especially given the most recent kind of respiratory surge season that we had that was very taxing, I think, on everyone. And we had a lot of peripheral sites taking care of sicker pediatric patients than maybe they typically would have, just given the volume and the amount of children that were getting quite unwell with the viral illnesses going around this past few months. So our agenda for today, we are going to talk about our team, kind of what our current resources are and who the other members of our team are. We'll overview kind of what we do, what our job summary is, what we and kind of what our goals and our vision are. We will talk about our external support, and that includes kind of what support we can offer you all coming from different health authorities and different sites outside BC Children's. We'll give some examples of some telehealth support calls that we've received, discuss some key learnings, and there'll be time at the end for some questions.
So the critical care outreach nurse role, it was a role that was new to the hospital. We launched in April 2021. We did put a lot of research into building the role based on what other centers across Canada had done. So some of you will be familiar with something like a critical care outreach team. They might be called different things at different sites. So currently there's 4 PICU RNs, pediatric intensive care, that make up the team. We are scheduled noon to midnight, 7 days a week. Those hours were chosen strategically. Part of what we do is supporting the wards in the building. And we wanted to make sure that we covered part of days, part of nights, reaching as many nurses and kids and families as we could. And also a lot of the support nursing roles on the floors, like the CRNs and the educators, they go home at 1900 or 2100. So we wanted to make sure that we kind of covered some of the hours when they weren't around. And then, as Parker mentioned, during the most recent respiratory surge, we were asked to increase our coverage to 16 hours per day. So we extended our hours to anything from 0900 to 2400 or 7 a.m. to midnight, and extended our hours until the end of March. And now we've gone back to our noon to midnight original hours.
Yeah. Yeah, and then in addition to that, all of us work in PICU as well. So we do have PICU shifts slotted into our rotation. So we do still work in the ICU here just to keep up on skills and ICU kind of work. And then a little bit about us. So I'm Parker. I've been an ICU nurse for about 7 years and joined the BC Children's team in 2019. And then I joined CACCN at the beginning of last year. So other than that, also worked with the CDC, with UBC School of Nursing, and really passionate about simulation education. I'm a PALS instructor, so that's one of my kind of something I enjoy doing outside of ICU.
And then I've been with BC Children's for 10 years as a registered nurse. I've been ICU for 8 years, CCON for 2. Currently working through my Master of Nursing with a nurse educator concentration at the University of Victoria, doing that part-time. And then I also do some volunteer work with an international group called Cardiac Alliance, and have done some nursing education overseas in Iraq and Libya, and then most recently in Ukraine.
Perfect. And then our other two colleagues, Denise and Anna, who couldn't be here today, unfortunately, very well-seasoned ICU nurses, have about 10 or 15, maybe 15 years plus experience in pediatric ICU. For our CACCN duties, we essentially, as a CACCN nurse, we provide leadership and delivery of many care activities, both within BC Children's and outside of the hospital. We provide leadership to the team members by collaborating with patient care and both quality activities as well. We act as a clinical resource by providing consultation and clinical support to interdisciplinary team members, both internally and externally. In collaboration with the nurse educators, both in ICU and also throughout the hospital, we identify kind of nurses' learning needs, any trends we're seeing, and we kind of help evaluate and create plans to address those learning needs, kind of in tandem with other educators and clinical resource nurses throughout the hospital. And then we also participate in competency-based education and preceptorship pathways.
So our vision for our CACCN initiative, the first one will be kind of the most relevant at the provincial level, at least. So we're here to foster relationships and increase access to critical care resources. And that's probably the piece that we'll dive into the most in this presentation, because it really speaks to what we do outside of the four walls of BC Children's. On site, we collaborate and build capacity in our nursing staff, our residents, our allied health. We deliver standardized ICU follow-up for all of our kids that have spent time in the ICU and then transferred to various wards or step-downs throughout the hospital. And then we support staff in assisting with assessing and stabilizing kids that might be deteriorating on the floor, teach them how to best manage these kids so that they could stay on the floor. Or it might even be the case that, I think we should move toward a PICU consult and support the nursing and the medical staff through that.
Yeah, and then within our hospital, anybody can consult CACCN. That can be nurses, RTs, physicians, even families can consult critical care outreach nurse for assessment. Really, the goal is not to kind of replace existing systems for escalation of care, but we kind of work together in collaboration to address the patient needs and help them to kind of work through their assessment and maybe help them support through any interventions they need to provide. And then in terms of outside the hospital, we are available to do kind of the same thing. Anybody can call our outreach service, but we always want to remind people that if they need a PICU consult or they're looking for advice from Children's, we still need to go through the proper pathways, and that is through the PTN network. And then through that, we can also access Good Sam, which is a video app. I'm not sure if anybody's familiar with that, but and then we are also able to access that as well. So a video is something that you feel like the nurse who's calling CACCN or the team member who's calling CACCN would be beneficial. We are also able to do that as well. Yeah.
So early last year, after we'd been launched for about a year, we just started to identify ways in which we felt like we could be most helpful on site. So we kind of identified three strategic priorities to pursue at BC Children's. One of the first things we noticed when we launched was that we were delivering a lot of family support. We anticipated supporting patients as they left the ICU, but we found ourselves supporting families quite a bit who had, kind of, I think when families are in ICU, they're kind of in a bit of shock. And then once they get transferred out of ICU, they have that opportunity to reflect on their experience. And that's where we really found we were delivering a lot of support. So we connect fairly regularly with our psychology team in-house. And we talk a lot with them about trauma-informed practice, and they kind of coach us in ways to support these families. The second initiative that we identified was kind of a need to go back to basics with our staff upstairs on the wards. So we support First Fives, which are initiatives to educate nurses in the first 5 minutes of a code situation while they're waiting for the code team to arrive. So visiting those ABCs and the back to basics and how to manage the patient while they're waiting for resources to arrive. We've been involved in a big initiative at BC Children's to launch caring for patients with tracheotomies on the floors. Previously, those patients had only ever stayed in the ICU, and now we are supporting nursing and physicians and the patients upstairs now that those patients can stay upstairs. And then finally, when it comes to critical care outreach, we're finding that as we are becoming better known throughout the province, we're starting to get more calls to support nurses as they care for pediatric patients that, as Parker mentioned, they might not be used to looking after. So that's kind of our third initiative for the year.
Okay. Kind of going on with the provincial outreach kind of that we provide, and probably what most people on this meeting are interested in. We're going to talk a bit about the external support calls and what we can actually help with from a pediatric critical care outreach nurse. Of course, we want to just remind everyone, and I think everybody knows, that we don't want people delaying activating a pediatric code blue and or contacting their attending or resident or MRP and notifying their clinical supports before activating CCON or calling us for support. And that may include their CNE, CRN, charge nurse, etc. But some of the things that we often get called about and that we are happy to provide support with is pediatric patient assessments. Some examples would be change in or decrease in LOC, seizure management, respiratory or cardiovascular concerns. We get a lot of calls about medications, infusions, specifically around pediatrics and pediatric dosing. So unfamiliar medications, weight-based dosing, and a lot of calls about sedation in pediatric patients. We offer pediatric protocols and skills support. So whether that's accessing a DKA management policy, asthma policies and procedures, navigating SHOP for pediatric resources. A lot of people call us because they don't have time to look it up, or SHOP, as we know, is kind of difficult to navigate, and maybe they can't find what they're looking for. So we often get called and we kind of direct them to the right place to go, and then we can walk them and guide them through the policy that they're looking for or the procedure they're trying to do. And we will share BC Children's resources as well. Usually we follow up with an email with whatever call we had, and just share whatever resources we find would be helpful in that situation. And then some other concerns that we get called about or we're happy to support with would be like sepsis, temperature management, fluid status, unfamiliar equipment or therapies for pediatric patients, and really any other clinical concern. We are happy to kind of work through together.
So here we've got, I won't read them all to you, but here we've got some very specific examples of calls that we're getting. As Parker mentioned, a lot of them have to do with medications and especially dilutions or reconstitutions for pediatric weight-based dosing. Some of the examples on here that are maybe more critical care focused or would be maybe some DNR end-of-life resources that we've been able to connect nurses with. Maybe some of the blood product, so the albumin administration, methylpred, stress dosing, maybe some of the opioid dosing as well. So yeah.
DKA 3-bag system, a lot of calls about like inotrope, how do I make it? How do I dilute it? What do I program the pump to do? Do I need a push line behind it because it's only going to run at 0.1 mils per hour? Kind of helping them to set up things like that.
I've got recipes for 3 different concentrations of epinephrine. Which one should I be using for a child of this weight? The
next couple of slides are just kind of data that we've pulled because we do, we collect data on every call, both internally and externally, that we kind of attend or we're spending time with. That could be PICU follow-up, and that's also with support calls, both internally and externally. So this is actually data, sorry, our colleague pulled this data for us. So I want to say it's from when we started.
I believe it's from the launch of the team, which was April 2021 to January of this year.
Yeah, so essentially this is just showing, this is specific to external support calls. 53 support calls. This is like a graph of where the calls are coming from. Largest amount of calls are from Penticton, Abbotsford, Chilliwack, and UBC Hospital. There's also a large chunk, the 11.3%, which is from other, which may be some other specific location that isn't part of our drop-down list, or it might not have been specified early on when CACCN launched. So.
And then what we can gather from these two slides, as you can see on the left, the majority of our calls come from bedside nurses. And then on the right, you can see that most of those nurses are calling from emergency departments, and then maybe half of that number are calling from pediatric wards.
Yeah, we also get calls from nurse educators, charge nurses, not really RTs from external centers, I would say, in my experience, and also some physician calls. And then, yeah, other areas, general wards, and I think I've gotten a few calls from like recovery, kind of ACU, PACU units as well. Almost all of our calls are coming through telephone. At the end of this presentation, we will share kind of how to contact us if you don't already know, and kind of like a poster that shows how to contact us. And most of all of our calls come through telephone. Some come through email, which mostly are not urgent, asking for resource sharing or just follow up. And we have a CACCN email as well that all of our team members have access to. And then a lot of these calls are coming from, well, mostly I think over the last few months, they've all been kind of infectious related, whether that's viral, pneumonia, septic, and a lot of respiratory support calls as well. As you can see through this data, I know the numbers and the font is pretty small. And then what are we supporting? 61.5% are support with navigating, accessing, and guiding people through and to pediatric resources, protocols, and policies. And 44.2% is supporting with accessing additional pediatric resources. And a lot of that is, again, medications, infusion related, or pediatric specific protocols.
So this is the best ways to get a hold of us. So the critical care outreach nurse at BC Children's carries a cell phone. That's 604-875-2133 is our direct line to our phone. As we mentioned at the beginning of the presentation, our hours are noon to midnight. Outside of those hours, we do have our ICU charge nurse and our ICU case nurse available, and they can definitely field calls that we would be fielding during our hours. We are available to talk about patients from newborns to 18 years. And you can see, again, we've alluded to the most common calls that we get about medication and infusions and pediatric protocols. And then last but not least, we always hit this point home. You know, if you are looking for support, turn to your local supports first and foremost. So your nurses, your nursing leaders, your more senior nurses, your most responsible physician on site. And then by all means, if you need further support, that's why we're here. And then at the very bottom there, just some QR links to a lot of the resources that we end up connecting clinicians with.
Yeah, this is just, again, kind of a summary. This is our CACCN email. If you had any non-urgent questions or requests, that's listed here. And I think we are done with our presentation. So if anybody has any questions, feel free.
Excellent presentation, Parker and Jason. It's nice to see this all pull together after so much work that your team has been involved in for so long. And such a resource for people definitely outside of the Lower Mainland that aren't used to caring for children in the ICU.
Yeah, it's been really cool to watch the role and the initiative evolve over the last 2 years now. You know, when we launched, we anticipated supporting our in-house nurses and clinicians. We knew that there was always kind of potential that it could expand to support at the provincial level, but now that it's actually happening, it's been really interesting and exciting to watch it roll out. So.
I'm curious if you have any plans, and this may be like at the very beginning stages, but I'm curious if you have any plans on publishing this work or writing about it in some way. You
Good
mentioned that
question.
there were other areas that had done this, so there's certainly opportunity to share.
Yeah, I can speak for myself in that, as I work through my master's program, I've definitely kind of tried to figure out ways to do a two bird, one stone scenario where I can pull from my experiences at work and apply it to the work that I'm doing at school. I don't know what that looks like yet. We're doing some work with some physician leads on site, looking to move towards more regular provincial support, and even potentially, down the road, some kind of post-intensive care follow-up. A lot of you most of us have heard of, post-intensive care syndrome in pediatrics, and we've started to look into what that might look like if we started to kind of educate and combat that post-intensive care syndrome. So what might follow-up look like? Those are the questions we're asking right now.
Sounds like some good stuff on the horizon.
Yeah, it should be pretty cool.
Yeah, that's exciting. I know there's a lot of research happening in BC right now, at UBC in Vancouver, about post-intensive care syndrome for adults and critical illness survival and how to support patients after they're discharged. But I was not aware of any for children, although I'm sure that's in the works, as you said.
Yeah, I don't think it's as far along as the adult stuff. I think the pediatric piece, the post-intensive care pediatric piece, adds an interesting component when it comes to parents. And as we mentioned, when we first rolled out, a lot of the support that we were delivering was to parents and families. When a kiddo transfers out of the ICU to the floor, they're one of the most stable kids on the floor because PICUs had this opportunity to stabilize them, and we wouldn't be moving them out of the ICU if they weren't stable. So we're finding a lot of the time the kids look great and don't need a ton of ICU follow-up. It's the families that are really kind of leaning into us and are voicing a real appreciation for that continuity of care, seeing a familiar face on the floor that they got to know in the ICU.
Yeah, I bet. Does anybody else have questions for Parker and Jason?
Has anyone called our service before? We were talking about that before the presentation. We're like, I wonder if anyone's actually called us.
I work in mostly rural areas, and it would have been awesome. So I'm actually excited to share this around Northern Health, because I see our numbers are kind of low outside of our main urban center of Prince George, but and Haida Gwaii, which I see is on there, which is great that I see them using it, because that's the island in the middle of nowhere, right? So I'm glad to see that they're using it, but I definitely have snipped your poster and I will share it at the latest meeting that we have coming up. So I think it's fantastic. So thank you. As a previous Emerge ICU nurse that was deathly scared of children, I am excited. I could have used you guys a lot. So thank you guys very much.
Perfect. Thank you.
I just came back from a trip to Bella Bella to roll out our CCOT rule support. So similar to what you guys do, but from a critical care adult lens. And your number is now plastered everywhere with ours, just so you know.
Oh, good. Great.
So we gave them an algorithm so that if it has anything to do with kids, then they go straight to your phone number.
Oh, lovely.
Perfect.
Oh.
And then I see Trisha has asked if Victoria General Hospital is ever called.
That's a good question. I haven't looked specifically to see if Victoria has called. I'm just thinking out loud here. I wouldn't be surprised if they haven't. And I only say that because they have their own ICU, and I anticipate that their in-house resources are quite strong in terms of pediatric resources. That doesn't mean they haven't called, and yeah, it's very possible. A lot of our calls are coming from sites that don't have pediatric in-house facilities, so they don't have a pediatric ward or they don't have a pediatric ICU.
I remember I was working in Interior when this first rolled out, and we were so grateful for this resource as we were trying to, increase pediatric competencies in the ICU.
Sorry.
I was just saying it's definitely an exciting initiative in that, you know, when we first, like I said, when we first rolled out, we would get like one provincial call every 2 weeks, and then it really started picking up speed, and we're getting one a week, and now we're getting kind of one a day. So yeah, it's exciting to share with the rest of our ICU team, because a lot of them just, they don't know that this is going on, so they get excited to hear that this is happening as well. It's good.
Mm-hmm. I bet that it would be helpful for parents around the province to know that this resource is available too. It probably is a big relief to them, knowing that maybe the care that you can help provide prevents them from having to, you know, come south for care at higher level of care, and they can stay home in their home community.
Yeah.
Yeah, that's a good point, Sybil. And yeah, that's kind of an exciting piece about this, you know,
Child health.
yeah,
Yeah.
and pursuing this, maybe this post-intensive care syndrome pediatric follow-up down the road. We'll see what happens with that.
Yeah, and essentially we're working closely with our PICI fellows, and also Jenny Ritalik, who's one of the leads on the Child Health BC big project going on right now, and we're trying to kind of figure out, or in the process of figuring out, how we can work better with transport calls, and how we can be brought up more when physicians are calling our team for advice, or potentially transporting a child to BC Children's, and making sure they ask, you know, are nurses comfortable? Are they feeling supported? Do they need any help? Because we have our CACCN nurses here available to help them. So that's another thing that we're kind of working on. So yeah, that's in the works.
Pursuing that that little tweak in the workflow to get, just to prompt our physicians on transport calls to, like Parker said, kind of ask, I also have a critical care OH nurse. Do your nurses need any support that they can deliver, and that sort of thing?
Excellent. Well, thank you for coming to present with us. This is a lot of people have reached out and said, oh, I'm so excited you've asked them to come. So I imagine that we're going to get a lot of views on this video for sure. So thank you all.
No, thank you for having us.
Yeah, call often. Thanks for having us.
Thanks.
Yeah, okay, great. Take care.
Thanks for watching, everyone, and thank you for joining us on the BC chapter of the CACCN YouTube channel. We have a lot of great content from previous events we've had over the past 12 months. I would suggest subscribe and hit the notification button so you can know when the next thing is out. And if you ever want to come to our next event, we're on Facebook and on Instagram. Our links are listed below. And while I'm on the topic, if you're a critical care nurse anywhere in Canada, why don't you join CACCN? We have a ton of resources to help you be the best critical care nurse you can be. Go to caccn.ca and join us.